Hi, everyone. Stuart Gandalf here. Welcome to another podcast. And I was just speaking offline with Dr. Douglas Flora about how excited I am today. Welcome, Doug. Good to talk to you. So, Dr. Flora is Executive Medical Director of Oncology Services at St. Elizabeth Healthcare. He's also Editor-in-Chief of AI and Precision Oncology. So, again, welcome, Doug. I found you, as we talked about a little bit offline, I often interview people that speak at conferences that have really compelling topics. And so the topic that caught my eye was secrets of marketing with, to, and for doctors. So I'd love to get a sense of, the talk you gave, where you gave it, what it was about. Let's just start with the beginning, and we'll take it from there.
Yeah, thanks for having me, Stuart. That was an interesting one. So I'm a medical oncologist. I see cancer patients downstairs in my cancer center. This one came across my desk, I think, through LinkedIn, and it was an interesting one because it was a group that we'd worked with before, Writer Girl, my hospital system had worked with, and I think they found me more approachable than others that they were trying to work with. I think that's the gentle way I'll describe it, but there's been a general reluctance or little abhorrence, I guess, for working with providers because we're busy and we can be demanding and, we have our own needs. And so one of our colleagues at Writer Girl invited me to participate in a panel in a seminar in Las Vegas. And it turned out to be a blast. Not my typical panel discussion. On the top, usually I'm sitting there talking about research trials and artificial intelligence. And this one was much more about how do you connect with your audiences and how do our marketers connect with our providers.
It's such a great topic. And we're going to talk a little bit about we just actually wrote a blog post not too long ago about this, like how to engage your doctors, and the fact that you covered the same topic, I love. And of course, I want to get your input on this. Why do you think it's an important topic? I have some of my own thoughts that I'll share, but I'd love to hear, this obviously was a fun topic for you, and I'm assuming it went over great with you. Why do you think it's important?
Yeah, for me, especially in cancer medicine, but healthcare in general is a team sport. It's a complicated thing with thousands of moving parts. And a lot of what I do as a cancer doctor is messaging to people out in my community, trying to prevent them from needing me. And so I got involved on the and we don't even call it marketing, we call it storytelling side. Not trying to drive volumes, but trying to drive screening and prevention and early detection and those sorts of things. And found myself in this strange role for my healthcare system and for my cancer program as a storyteller in chief, and became familiar with these concepts because it was really important to me that patients heard the messaging through our marketing department that the doctors believed in to save their lives.
I love that. And, it's funny, one of the things that in our own company and people I know in this field, they don't want to necessarily be a clinician, but they still want to help, right? So if they can help amplify that message, and then particularly today with so much misinformation out there, to get some credible medical advice is great. And I love that that's your motivation because clearly the consumer needs that. Also the part I was going to talk about as well, as you get that information out, it's so important from a digital marketing standpoint to Google talks a lot about EAT, experience, expertise, authority, and trust. And having doctors at the center of this can build exactly that. So if you're trying to build a website that has thought leadership in the community, as well as nationally, you're able to amplify the message a lot more. And the your money or your life topics, as Google sometimes talks about it, healthcare is one of them, right? Like it's a very, very important topic. Tell me about, on that note, some of your favorite maybe anecdotes of recent things you've been doing on some of the, with your own hospital. I'd love to hear some of your stories of how you were able to actually, get the message in the community to help drive screenings. So I'd love to hear a little bit more about that.
I'm very fortunate. I live in a very mission-driven hospital system. The team rose together, and we really have thrown ourselves in for a lot of investment and attention to lung cancer screening. I'm practicing in Northern Kentucky, just outside of Cincinnati, and it's the #1 state in the country for lung cancer diagnoses, late-stage lung cancer diagnoses, lung cancer deaths. When we started this, I realized that is where we could be great. And so we put a lot of structure and investment in our system, as well as marketing messages to our physicians and our community about the importance of lung cancer screening. And, lo and behold, it was an effective message. People recognized that there was some urgency here, a problem to fix. And then with the right messaging and with the right coordination between providers, administrative teams, operational teams, and the marketing team, our community really bought in. And so I think we're in the top few cancer centers or programs in the country for lung cancer screening. And Kentucky now, I think, moved up to number 2 of all the states for a good lung cancer screening, which doesn't happen much in healthcare indices for Kentucky, as you might imagine.
Yeah.
And it was on the back of really storytelling and talking about the lives saved and talking about the mission.
That's fantastic. I love it. See, that's a deeper mission and deeper purpose than just getting more clicks or more traffic to a website. You're saving lives. Do you ever get to actually meet patients that have come in from the screening directly or indirectly from the work you've been doing?
All the time, and they're a big part of our marketing story. They approach us and say, if you ever need me, Dr. Calhoun took out my lung cancer and saved my life. I'd love to tell people what he did for me, one of our thoracic surgeons and other. So yeah, it's a big part of our program here. A lot of print, a lot of commercial type stuff, a lot of patient testimonials. I just filmed one the other day with 2 patients down in our resource room because I think their stories are very compelling. And a lot of times they have heard this from doctors for 20 years and not gotten the tests done. But if you find out that colonoscopy is not that big a deal from patients whose life was just saved at colonoscopy, then that might cause that what you guys call a call to action, right?
Yeah. It is funny how that works. The idea of using storytelling, and if they don't know somebody directly, indirectly through storytelling to help them communicate that. And it's funny, I was um, thinking of people that I've known that have had colon cancer or people I've known that had shingles or whatever, like where there's like, wait, he was too young to have shingles, for example. Wait, okay, I need to get that vaccine after all. So it happens for sure. The mission driven part is awesome. Do you have anything to say about that? Because that's, I find that from working with lots of hospitals, lots of providers, some are just, I think they're all doing good, right? But some really take it like they're in their mission, like they just believe it's their job to promote into the community and to better healthcare. There's a continuum there, and it sounds like yours is at the far end of that, which is great. Any lessons from that? And does it feed itself over time? Are you able to help push that agenda? I'd love to hear a
A
little bit
great
about
point
that.
that you raised there because it's not necessarily in physicians' DNA, right? To be marketers, it feels cringy to us. We hate that word. I don't like billboards with my face on it. I don't want any of that stuff. What I really want is things that help us mutually help patients. Like you said, when you wake up in the morning, you want to make a difference.
Right.
You have an impact on the world. You want to make a dent in humanity, like Steve Jobs said. Um, our marketing team here, they are cancer fighters. Our social media team are cancer fighters. Our public relations team are cancer fighters. And we've embraced them as members of the team, recognizing that they have unique skill sets that help patients just like I do. And so I think that's where our system might be a little aberrant is that everybody here is fighting cancer. The people who are in the cafe making coffees right now are giving my team energy or giving that patient a piece of pleasure that day. And so we've embraced that idea that this is a team sport. And maybe that's why we're so strange. Nobody likes the idea that you have to market yourself to generate volume or click through rates or the other things that you guys are required to prove utility. But everybody wakes up and thinks, gosh, it would be great if I collapsed into my bed tonight and I saved a life. If I could make a meaningful difference for someone, I think that's the power of messaging is your people, your audience, using their God-given skills to help people like me use my God-given skills.
Right.
It's really beautiful when it works.
That's fantastic. I think that mission is so important, and it's a good reminder. It's really easy in the day to day, and it's a good reminder for me with my own team to remind them. And we do talk about that. We work with some serious stuff on our team, and for example, one of the categories we do a fair amount of work in is addiction, and we have people on our team that have conquered addiction, and so it's very personal and very meaningful to them to do that. And everybody has an experience, one or the other. But I love that. I bet your culture is pretty strong over there. If they feel like they're all fighting cancer together, anything else about that? I'd love to. I just think that's really a compelling thought.
It is powerful for all of us. I mean, we are all one step away from needing a cancer doctor, and everybody wins if the patients are caught with early diseases. So that is something that marketing can do better than doctors.
That's fantastic. So, all right. So again, I would just, having worked with a lot of different providers, I would say you guys are on one side of a continuum, right? There's everybody again wants to be part of this. Some have more buy-in than others. Marketing departments, a lot of hospitals are what I call the kids table. Like they're not even in the room. They're not even considered. So, in fact, in that case, when we talked about this a little bit offline, a lot of times in those cases, the marketing team may not even have much experience dealing with doctors. So like, where do you feel like hospitals, where are the hospitals, practices, marketers, what are they missing? Like, what opportunities, if they're, somebody's listening, like, I want to go work with Dr. Flora's team, but assuming they can't, like, what are they missing and what can they do to start marching in the right direction?
I could say, and this is something I tell my teams, it's something I tell my kids, it's something I tell just about anybody who will listen without rolling their eyes. There is a fantastic article in Harvard Business Review a few years ago, written by Clayton Christensen, and it's called "The Job to Be Done," and it is gold. It is just seminal human beingness. And what he talks about in this is why McDonald's is able to sell more milkshakes at this place, or why this particular approach to solving a problem with refrigeration in India worked. And it's a victim that should be as present in oncology as it is in marketing. And that's identify why I would hire you as a doctor, Doug, why I would hire you over the other doctor, why I would hire your healthcare system or that machine or that tool or whatever. And you guys talk about all the time that you don't sell the drill, you sell the hole.
Yep.
The same thing for the customer's job to be done in healthcare. My patients want less terror. They want better outcomes. They want less suffering. They want fewer side effects. That's my job. Your job might be, if you work for a healthcare system or a hospital system or a group of physicians, help them sell their wins to their community so they have more wins. And I think part of being the marketer is identifying the customer voice, right? And what is it that defines a win for that group that you're working with? So my large hospital system might want a completely different thing. I can afford to be mission driven here because this is a mission driven place with a mission driven senior leadership and board. But if you're in a private practice office that's barely surviving in some very, very small town in Missouri, you might just want to keep the doors open. And so the marketer for them, it might be driven around volume. For me, it's not necessarily. We like volume because we believe in our product, the care
Right.
team. Not to digress, but I just spent an hour and a half with our two marketing people here, and it was all about mission. It was all about I am so driven to get people into my building, not because it's profitable for us. It's often not. If they're commercially insured patients, maybe not government insurance anymore. But I'm eager to have their cancer care experience happen under our roof where they're touched by a navigator or a massage therapist or a food pantry or a geneticist or just a team of people who care about them. I want to save them from being on some conveyor belt somewhere else in some rapid fire clinic.
Yeah, for sure. That totally makes sense. So again, I think it's just inspiring. I love it. I'll share this with my own team because I think it's a good reminder for everybody.
Look up the article; it's good.
Yeah, I will for sure. Absolutely. Every time I do one of these, if I get a good reference like that, that'll be in the notes for sure. So, like again, if you have a marketing team that, and we were joking about this a little bit off time, sometimes they're a little intimidated, and the doctors aren't always necessarily, if they're uninitiated to this process, excited. So, how do you recommend engaging them? Like, if you're talking to the marketing team, they haven't had a lot of experience, what kinds of tips and pointers would you suggest?
I think you start where you are, work with what you have, do what you can for one. It's just the realities of medicine is that doctors wake up 2 hours behind every morning. And
Yeah.
so I think to effectively communicate with them, you have to be efficient. There has to be a value add, and the mission is a huge one. Um, you have to be, I guess, respectful of the fact that they are going to be somewhat distracted most of the time because they've just told somebody they're dying or they're getting, power texted with an MRI result that's come across while we're talking on one of my beloved patients with brain metastases, and I'm anxious for her because she's having new symptoms. So sometimes it has to be a structured thing. And what I've suggested to other teams who've asked, and when we were in Las Vegas, was try and consolidate this when you can. Our team does a phenomenal job with this. What I mean is, when I get a new hire who is not super busy yet, we take them for like an hour and a half on video. Makeup is there, new crisp white coat. They're prepped for questions. They get a little media training, and we let them tell their story before they know any better. But we make use of that hour and a half so that we have B-roll and footage and quotes and things we can turn into infographics for the rest of the year on every holiday, and we'll run them through a script that has their entire year's work. Let's talk about your favorite Halloween costume as a kid, or what made you want to go into medicine, and then we see that parsed out all year long by our media teams. And I think that's a brilliant way to do that. So that way you get the doctor once for an hour, but you get a year's worth of copy or a year's worth of content that you can then parse out as you need to as the year befalls or as the year progresses. So that's a very attractive way for me as a doc to consolidate that rather than I need 4 hours a month. That's not going to happen with most physicians.
Yeah. And you mentioned the realities of working with oncology. We've certainly worked with tons of oncology businesses and practices over the years. And exactly that, somebody comes out of the room, I just told somebody they're terminal. It's a little hard to switch on the dime there. This is real stuff we're dealing with, particularly in oncology.
Yep.
I love that you guys are planning that out. That's great. And and you mentioned media training, some in any human subpopulations, people are going to do better things than others. So I love that you're doing media training. Are there people you just can't convince to participate, or is pretty much, yeah? Okay.
Yeah, for sure. I've got two particular physicians who I think are amazing humans, and they won't even do radio.
Okay.
So you ride the horses that you got, and I've got a few people who recognize the need and have skill and initiative, and they want to participate in this. So if I'm not available for some interview for a magazine or for a newspaper or some TV news appearance or whatever, I know the next two I'm going to call because they've enjoyed it and they perform well, and so that you tend to find your champions within each division, I would suspect.
It's true. And it's funny because I find that, again, in any population, you're going to have, and it depends on the business, right? Specialty, like you were mentioning earlier in cancer, a lot of oncologists, they're so busy, they don't need any patients. It's not certainly a big issue for them. But there are specialties we work with, like, for example, orthopedic surgery, where one doctor is more forward, more out there, and can build his practice and lap the older doctors really quickly because they like this stuff. They enjoy this stuff. They're good at it. So we see that, periodically. On that note, you have stars. How do you leverage them? You've got people that are good at it. They enjoy it. They like it. Any anecdotes of, because that's, in my experience, it's always great to double down when people are good. And so is that something you guys can do?
I hired for that. I've picked people specifically in interviews because I saw the potential there to help me outside of the building as much as inside the building. And so that's a conscious decision, sometimes strategically, is to make sure you have people in your team that can sell a story, can tell a story. We use the DISC training here. I don't know if you guys are familiar with
Sure.
it.
Yeah.
So every team needs an eye. And if you're unbalanced and it's all driver executors, then you're not going to have everyone who is comfortable or excited to tell the story. Your C's and your S's are worried about precision and support. Get the eye out there and let them build teams. That's obviously what I am. And my role here in our cancer program tends to be more around the team building and culture and support and initiatives and innovation than the back of the store stuff. We have really, really strong people who help me do those things much better than I could myself. And I try and stay out of their way.
That is really compelling. I think that's the first time I've heard a doctor that considers that. And for the listeners who are not familiar with DISC, DISC is a model. You've seen different models with different names. DISC is the leading ones, where some people are analytical, some people are controlling, some people are influencers, and others are more, what's what I'm missing, supportive. Any people. So the DISC program is an outstanding, in fact, I'll link to that too. It's a model we've taught to, and I learned a slightly different variation, but it's a terrific way of categorizing, making quick decisions on people. And eventually, when you get good at this, you do it naturally, right? In terms of patient communication, and how do you talk to a patient in a way that they will hear you or talk to your colleagues. It's fundamental. On anything we should have talked about, that we'll talk about your advice in a moment, but what we've missed, what things would be really intriguing as somebody is thinking about this kind of a topic, engaging doctors to get the word out, for better patient care, for better results with the hospital or the business, anything else we should have talked about?
How about maybe could I provide some use cases for how you might approach a physician or things that a physician would be interested in participating in?
I think that's awesome. Yes, please.
'Cause I'm running my list of my doctors in my head here
Yeah.
because some of them won't. So
All right. I love it. Do it. Let's go for it.
It's interesting for different providers. There are different levers that you have to pull, right? We have some that are desperate to increase clinical trial enrollment because they really believe that research is the way to cure cancer, finding new drugs, developing these trials. And so, for a person on the marketing side, maybe you engage them in helping them sell their vision for what clinical trials can do while helping the institution at the same time. I have some that are absolutely reluctant to engage in any social media at all. We use Sprout here, and I have doctors I will never get to open an email about that, and they will never repost, even if it's just a one button to share on social media. But that same doctor is really, really willing to go down and do an inner city cancer screening event with 6 hours of her own time, right? And so it's different people are motivated by different things. And I think that's where I look for the levers that we can pull for the greatest good. As a marketing team, you probably have identified which physicians are your hyper articulate people, the people that you really want telling your story. The introverts probably are the wise ones, right? They may not be perfect for something like this because I enjoy these sorts of conversations myself all the time,
Yeah.
but they might be the people who would really, really help contribute to an event because they want to be in there looking for abnormal moles in a cancer screening event or something. So everybody has their thing. And I will tell you, there are very, very few providers, doctors, nurse practitioners I know who don't want to help. Some of them may not be camera friendly. That's a terrible way of saying it. May not view cameras as friendly,
Yeah.
uh, but they are absolutely skilled in other areas. And I think we found that some of our people, we will feed them articles and let them edit and approve articles that come out with their byline. That doesn't require them to speak live on camera, but it lets them talk about things that they're passionate about. And so sometimes it's finding those unique skill sets. Say, well, okay, that person doesn't want to do something with a microphone, but she writes really well. Let's have her do an op-ed, something like that.
That's awesome. Well, that's awesome advice. I feel like really what we're talking about here is playing to people's strengths, right? And to find and um, I guess just thinking that through, it's the attitude of the internal team, if you're working with an internal team or with an agency, to plan this out better, think about the needs you're trying to make, and then really going back to what you mentioned there earlier, another way of looking at that is, you're still appealing to their self-interest. Like I want to be published, I want to do more clinical research, I want to help more people. Whatever the case may be, if you can show them why this matters and why it's relevant to them, that's going to be a lot more effective. Well,
Mhm.
fantastic. Go
That's
ahead.
where I went back to that customer's job to be done because a private practice doctor has different goals than an academic person trying to make their bones and earn tenure. And so the marketing team consolidating those things together makes a lot of sense to me and being very intentional about what do we need here. Go where the doctors are. We have all provider meetings. We set up a room over there. That's where they get their headshots. They're there anyway. We got it Thursday night. There will be a guy there with a background and a good camera and makeup. Get your headshots done because they've got a captured audience there anyway. I'd say the marketing team, that's a really nice way is go where the providers are, and you will find them. You don't have to chase them down. Though we come together quite a bit in meetings, and if you are there and you have 10 minutes on the provider menu to talk about the importance of them sharing your social media, there you go. That's a start.
That practical advice is so real. I've found that exactly the same thing. Like if you trying to narrow people down and get them to come to an interview in the middle of their busy day, it's going to be really, really difficult. But doing it in a place they have to go anyway is a great idea. Then there's like not as many excuses and you get a chance to prep them. Well, Douglas, I've really enjoyed speaking to you. This was you're good at this. I love it. It makes my job easier.
Our conversation.
I got some good insights, and I invite you to come back anytime. If you're, think of us as an extra vehicle that you can share your story for your hospital. It sounds like you guys are doing some great things, and it's been a pleasure meeting you.
Likewise, pleasure meeting you. Thanks for having me.
Thanks. Seriously, great job. I'll edit this part out. I appreciate your time. It's
Great.
what I said is 100% true, very concise, very clear. I learned some things. That's really great. So I love it. And I love your mission. It is inspiring. It's like we work with clients of all different kinds of businesses, hospitals, nonprofits, private equity owned groups, like, all the whole gamut. But, to remember why we're all doing this, I think is great. And that's with that message internally, that's going to bring out the best of your people for sure. So I
I'm sure
appreciate.
some of them still roll their eyes and don't understand it because they are doctors. But yeah, I've been doing this on LinkedIn for about a year now and got to 1 million impressions, and really was able to get things done here that I couldn't have done without that reach, because my board sees those posts and my boss sees those posts, and it is strategically visible. So we've gotten funding for new initiatives because we've shared our successes broadly. Who wouldn't want to do that? It lets me chase the things that I really care about in the building, because people outside of the building are willing to give me a $10 million donation because they read about it.
No, it's amazing. Well, let's think about actually, do you mind if we just, I want to edit this a little bit. I don't normally do this, but I'd like to just ask you for the tape, like what about some of the benefits of doing this? Because like what you just said there was really great. So
Okay,
you might.
go ahead and I'll be ready.
So, um, just another question is, what are some of the benefits? Like, what are the tangible sort of side benefits of the kinds of work that you're doing? I'd love to hear more about that.
Besides saving lives, right?
Yes, absolutely.
Yeah.
Well, that's what I presume, but it's a good reminder to everybody.
This is my brother cares deeply about research. Let's do marketing to get more patients on clinical trial because he believes that's how cancer is going to be cured. We have people that want to do cancer screening. If we get that out of the community, we save more lives by cancer screening, and the people that run the cancer screening program feel proud of their jobs. For you and I, as we're talking about this, the marketing approach to this, the wins for the doctors are the same as the wins for the people in marketing. Make the world a better place. You make your day more efficient. You brought me in contact with people that enhanced my experience as a human being. And the things that you bring don't have to just be click-through rates and volumes. It can be other experiences. It can be other contacts or networks. For me, my own weird journey on social media, I've met some of my very best friends on boards that I was invited to because of my social media accounts. Um, as strange as it sounds, now these are people that are texting me all day, every day through associations I've joined or boards that I now sit on that I might have not been invited to had I not been visible. It's given me some opportunities to work with some really brilliant people to solve some complicated problems, which is one of my love metrics. So
That's great. Well, I'll just double that. We talked a little bit offline about LinkedIn, and LinkedIn is the new thing, right? That's really come just so far in the last couple of years. And, we've been doing as an agency content marketing before that world was made up for our own sake and for our clients. And, the unique thing about getting your story out, just like you and I were talking now, is, and just going back to what you said, some of my best friends in medicine were podcast guests, were people I met directly or indirectly from that. And this particular medium is unique because people get to know you. It's a little different than reading an article. So again, that was awesome. Thank you again.
thank you.